Hi. So today I'm going to be talking about sepsis and thinking about it as sort of an application of the immunity videos. So before we have sepsis, we have something called SIRS, and this stands for Systemic Inflammatory Response Syndrome. And systemic means that it affects multiple body systems. Inflammatory means you've got inflammation and it's inflammatory response, so you've got inflammation as a response to something, and it's affecting multiple body systems. So you're looking for a response that indicates inflammation, so you're looking for things like fever and increased white cell count. And in order to diagnose a patient with SIRS, you need to meet certain criteria. And the criteria we use are that you have more than one of a temperature above 38 or below 36, and that's degrees Celsius, a heart rate above 90 beats per minute, a respiratory rate above 20 beats per minute, or when you take a blood gas, PCO2, which is below 32, and then you have a white cell count of below 4 or above 12, and then also you can consider that more than 10% of the white blood cells being immature. And you can use that because that's showing that you're producing a large number of new white cells. So that shows that there's some sort of ongoing inflammatory response. So those are our diagnostic criteria for SIRS. So what about sepsis? Well, sepsis is when you have a systemic inflammatory response to an infection. So in order to diagnose sepsis, you need a systemic inflammatory response, or SIRS, and then you need a known or suspected infection. What makes this sepsis severe sepsis? That's simply when you've got organ dysfunction, which obviously is quite a severe thing to be happening, so that's another fairly simple definition. And then septic shock is when you have a systolic blood pressure below 90 as well as diagnosed sepsis. And shock is normally diagnosed as once the systolic blood pressure falls below 90, because that's when that's the level at which you stop effectively perfusing your heart and brain tissue. So for it to be septic shock, it's got to be below 90 despite attempted fluid resuscitation, and you also want to be seeing perfusion abnormalities. So if you think of the fact that when you're not getting enough oxygen, then you start performing anaerobic respiration, and you start therefore producing lactic acid. So if you're not properly perfusing your tissue, then you'll start to have anaerobic respiration going on, and you'll start to have lactic acid being produced. So when you take a blood gas, you'll likely see an acidosis, and the lactate will also be high. So that shows that you've got perfusion abnormalities, and if you've got this low systolic blood pressure, then you've got septic shock. So the most common infections causing sepsis, you have lower respiratory tract infections, for example pneumonia, and that's one of the ones we'll be focusing on today. You also have things like meningitis and encephalitis in the neural tissue. And then you can have cellulitis, necrotizing fasciitis, although that presents plenty of problems of its own, and bone and joint infections. So how do we treat sepsis once we've diagnosed it? Well, within 1 hour of suspecting sepsis, you should have commenced what's called the sepsis 6. And the way I remember it is as give, take, give, take, give, take. Because this is also the order in which you should do them. So you want to give high flow oxygen, because your patient is obviously going to be quite unwell. So you want to make sure that you're upping the levels of oxygen to ensure that they're still getting enough oxygen to all their tissues. You then want to take blood cultures. So this is so you can take a blood sample and take it to the lab and have a look at which pathogen is present within the blood, so you can work out what's causing your sepsis. You then want to give broad spectrum antibiotics, and this is to start treating the sepsis, but because you don't know exactly what's causing it yet, you give a broad spectrum antibiotics. This should ideally be done after the blood cultures, because if you start treating it, then you might not be able to work out exactly what is causing the problem, so there might be a more effective antibiotic that you could have been using. You then want to take a serum lactate and a full blood count. So the lactate is to check for perfusion abnormalities, and a full blood count is to check for your white cell count, to check for your levels of red blood cells, hemoglobin. You then want to start giving IV fluid resuscitation because the patient's blood pressure is liable to start dropping. And then you also want to take a urine output. And this should all be done as quickly as possible. So this is now talking a bit more about respiratory infections. So first I'm going to talk about bronchitis, and this is where you have infection and inflammation of the airways. So because this is in the airways, although it's a lower respiratory tract infection, it's less likely to cause sepsis because it's present in a less vascular area. So this normally presents with a patient with difficulty breathing, they've got a cough, they're coughing up sputum, and they've got a bit of a wheeze and fever. And the way you diagnose it is by taking a blood count, and you can see that the patient's hypoxic. When you listen with your stethoscope, they've got some crackles on their lungs, but their chest x-ray appears to be normal. If they've also got the sort of coughing up sputum and the wheeze, then you're starting to suspect it's a lower respiratory tract infection, but the chest x-ray is normal, so it's most likely bronchitis. Now, on the right-hand side of the screen here, I've got something called Curb 65. And this is a tool that's meant to be used to help clinicians for understanding when a patient has an infection, what sort of treatment do they need. So the 5 criteria are confusion, a urea above 7 millimoles per litre, a respirate above 30 breaths per minute, systolic blood pressure below 90 or diastolic below 60, and age above 65. So if you have 2 of these, then you should admit the patient for observations. So an example would be if you have a 67-year-old who's showing signs of confusion, then you should admit them. Now, obviously, there are a number of causes of confusion in older people, so you to some extent have to use your clinical judgment. But then if the patient has more than 2, then you want to start them on IV treatment. So say our 67-year-old who's showing signs of confusion also has a systolic blood pressure of 84, then you know that they're starting to show signs of significant illness, so you want to start IV antibiotics. We also have pneumonia. So this is infection and inflammation of our alveoli rather than of our airways. So this is much more likely to lead to sepsis because it's in a much more vascular region, so it's more likely to cause a systemic response. It can present fairly similarly with the difficulty breathing, the coughing up sputum, the crackles. But one of the key things that sets this apart is you're more likely to see pleurisy. And pleurisy is when you have pain upon breathing, when you have the movement of the pleura over each other, and this inflammation causes pain. And this can be a very sharp pain, which they notice particularly when they're breathing either in or out. You then will typically do a chest x-ray, and when you do a chest x-ray of a patient with pneumonia, you're very likely to see consolidation. So if you have a look at this x-ray on the right-hand side of the screen, you can see that the lung fields are clear for the most part, apart from this area here, which is circled, which is showing some opacity, and this is called consolidation. And that means that that lobe, being the right middle lobe here, is likely affected by pneumonia. You also, to confirm your diagnosis, want to take a sputum sample and then do microscopy, culture, and sensitivities to try and find out exactly which organism is causing the pneumonia, and then find out which antibiotics are best for treating it. So in summary, that is all you need to know about lower respiratory tract infections and sepsis. Thank you very much for listening.